I'll be able to like cut things and blah blah blah.
Okay.
So if something happens, then I'll be able to just cut it out.
Okay.
So thank you so much, Dr. Mobley Buckstein, for being here with us. I just kind of want to start off today with just a general question to get to know you a little bit better for people who maybe haven't had you in class or haven't had you in your practice site. So could you just explain a little bit about your site, about yourself, and about your practice site?
Sure. So I'm Wendy Mobley Buckstein, and I'm a 1999 grad here from Drake. So this is my 20th year being a pharmacist and 25th, 26th year in pharmacy. And so my practice site is Primary Healthcare Eastside Clinic, where I am an ambulatory care pharmacy specialist as well as a diabetes educator.
Cool, that's very cool. Could you explain a little bit about your site and maybe some of the things that you do there?
Sure.
As well?
So at the site, typically we are a referral basis. So our providers, we have mid-level providers, nurse practitioners, physician assistants, as well as DO residents, as well as 2 attending physicians that refer their patients to the pharmacy just for different things. And so when I say pharmacy, we aren't really a pharmacy at the clinic. We are an office, but we specialize in education mostly, but also medication management. So if the provider has a patient who, they have really resistant hypertension and they've put on a calcium channel blocker and an ACE inhibitor, and they're like, we don't know what else to do, they'll kind of send them to me. We'll go through a lot of different pieces. We'll really scour their diet, kind of see what kind of exercise they're doing a lot of different things to try and figure out kind of why isn't the medication that we're trying working, and then thinking about other ways that we can add on other medications. So we do a lot of that. I would say probably 80% of what I do though is diabetes education, and so I'm a certified diabetes educator as well as a certified health and wellness coach. And so I try to kind of weave the two things together, especially when I'm talking with patients that have chronic disease. And so just talking with them about their disease, kind of educating them more about what's going on in their body, and then doing kind of a deep dive depending on, if we're talking about diabetes, I'm doing a deep dive in their diet, what kind of things are they eating, how often are they eating, those types of things, and then what kind of activity are they getting, because that's really important too, because those are kind of the two, I would say, stone pillars that hold up the bridge. And so if you're doing well with your diet, doing well with your exercise, then we start looking at the road that's being paved above as far as medications and all the other things that they can be doing that might be helping with controlling their blood sugar.
And when you're talking about your site versus sites that maybe you've worked at in the past or different experiences, how do you really see this site being innovative and forward in progressing the pharmacy profession as well as helping patients?
Sure. So at my site, we do not have a collaborative practice agreement, but the providers there have basically given me pretty free range. When they refer a patient, they'll just say, titrate their insulin or manage this medication. And so what I do is I am meeting with the patient, I'm finding out about them, I'm making those medication adjustments, typing my note in the electronic medical record, and then sending it back to the physician or the provider, and they sign off on it. And so, I don't really have to go and talk to them and say, hey, I want to titrate this person's insulin. I just do it, I send it to them, and if they agree, they sign off on it. If they want to make changes to it, then they'll come and they'll talk to me, but typically they just sign off on it and we keep going that way. We've talked about doing a collaborative practice agreement, but I feel like it allows me to really work at the top of my license, as well as kind of showcase what I can do as a pharmacist and as a certified diabetes educator.
And I know that you are also in academia. You take on IPPE students and P4 rotation students. Could you kind of explain a little bit about how you're taking on students and what they can do in the clinic?
Sure. So I have third-year pharmacy students, and the third-year pharmacy students are able to do very similar things that the P4 students do, but the P3 students are monitored a little bit more than the P4 students. So the P3 students will come, we will go in and we'll interview a patient, and they might watch a couple of interviews to kind of get a feel for what questions should we be asking, what's the flow of the interview, that kind of thing. And then I'll let them interview the patient while I sit and listen. And so that way, if I think we need more information about something, I can jump in, those kind of things. And then we'll huddle after the interview, kind of talk about all the things that we found in the interview, and then talk about, here are some potential things that we want to maybe address with the patient. So then we'll go back in and we'll talk to the patient. Everything that we do at the clinic is patient-centered. And so even though we come up with a care plan as a team, we're going to go back and we're going to talk to the patient and say, are these things that you think are doable for you? Mm-hmm. And so then we work with them to make sure that our care plan is going to be something that's going to work for them. If it's not, we make on-the-fly decisions on how to change that up. The P3s are also experience topic discussion. They can experience journal club. They can experience kind of where we read an article and we take two different sides of, is this going to be helpful in clinical practice, or is this just buzz noise? And, just some of that kind of thing, just to kind of get them thinking more before they go on rotations. And then the P4 students are a lot more independent. So they come in, they may also kind of watch me do an interview, try to get an idea of what the flow of the office is, how do you do follow-ups, how are we tracking all of this stuff, kind of learning all of that kind of thing. And then they kind of go off on their own and they're doing things, and they come back and they'll talk with me about, here's the care plan I want to talk with the patient about. So they're really formulating a lot of that thing on their own without having my input, but then coming and talking to me about it before they go in. And so much more formal presentation of a patient, I would say, versus the P3s. We're kind of doing the presentation of the patient together.
Okay. And it seems like interviewing patients and forming a care plan is a really big part of your practice site. So how has getting a certification in, being a diabetes educator and a health coach kind of helped you further your practice and further your patient care?
Sure. So the Certified Diabetes Educator credential has really helped me in the fact that I feel like I have a lot more nutrition background than I had before. When I was in pharmacy school, we didn't have a diabetes concentration, so what we learned was kind of whatever you read on your own type of thing. And so when I studied for the CDE credential, I had to study a lot more nutrition information, and so I feel like I can do a lot of different things with that nutrition information. Not only do I help patients with diabetes, but I'm also seeing patients for weight management, typically for high cholesterol, high blood pressure, and all of those things have a nutrition component to them. And so kind of, utilizing that. The health coaching, I think, has probably been the hardest thing for me to incorporate into my practice, and not because it's not a good practice. It's that as pharmacists, we're taught to problem solve. And health coaching isn't really about helping someone solve their problems. It's more about helping them find their way through their problem by being curious and asking questions and helping them set goals related to that. And so oftentimes I find myself kind of having to draw back a little bit because I start to try and project a problem or a solution to a problem on the patient. And then I think, oh no, I can't do that. I need to let them try and figure that out on their own. So we ask a lot of questions. We're very curious. I think sometimes patients are like, why do you want to know that? Mm-hmm. But we ask a lot of questions and brainstorm a lot on ways that can help them, especially when maybe they're eating a lot of fast food, and they don't really know how to cook at home. And so trying to brainstorm ideas, could you look up YouTube videos to figure out how to, bake something, or how to, cook something like roast vegetables or whatever it happens to be. Trying to help them kind of look up some of those types of things, because a lot of the patients that are coming in, sometimes they are refugees from other countries, and so English is a second language to them, and so sometimes that's very difficult as well. And then trying to navigate just the healthcare system in general and some of those types of things. So I've found that using the health coaching techniques has been very rewarding, but it's also, I think, one of those things that as a seasoned practitioner and then going back and getting the health coaching certificate later, it's been a little bit more difficult for me to figure out, like, okay, I have to stop mm-hmm. and like really think about what I'm doing, when I'm using those techniques.
So you mentioned that you have multiple nurse practitioners, doctor, residents. How is your practice site kind of utilizing all that there is to innovate the pharmacy profession and patient care? And maybe where do you see your practice like in the next 5 years? Or
Okay. So in the next 5 years, I would say specifically, I think we're going to see more of the diagnostics still happening through the provider, so through the mid-level provider or through the physician, and then them sending the patient directly to us and saying, please prescribe medications for this individual. And I can tell you, frankly, I'd like to see that happen now, because I see a lot of times clinical inertia is kind of my buzzword for like probably the last year. Because what I'm seeing is patients come into the clinic, they have an A1C of 12 or 14%, and they get put on metformin. And for someone who's been in diabetes as long as I have been, like, just putting someone on metformin for an A1C of 12% is not going to help them. And so I would prefer that if the provider is uncomfortable with prescribing those medications, that they send them to me and allow me to kind of create a drug therapy regimen for that patient, and then work collaboratively with them to get that going.
Yeah, I think that would be amazing. And you already see it kind of in the VA system and kind of more federally health qualified places. So, my next question is kind of a fun little question, and this might actually pertain to you. So, if you wake up in a parallel universe and all of a sudden you're the head of pharmacy, or in your case, hopefully the next APHA president, what do you think is the thing that needs to be changed and addressed in either at your practice site or in health and wellness in general, or pharmacy in general?
I would say the thing that we probably need to focus on the most, and I think I know you're asking me 5 years down the road if I woke up now, but I think some of the things that are coming out right now, just from congressional hearings and different things, is trying to figure out how can we get fair prices for drugs. A lot of the patients that I treated at my clinic are patients that don't have insurance, or if they have insurance, they can't afford the co-payments or the premium or anything like that. And so they're coming to our particular clinic because we can help them financially with those types of things. And so one of the biggest things that I see at my clinic is, well, I have money to buy groceries or I have money to buy drugs. So, which one would you rather have me do? Well, of course I want you to eat, but I also want you to get your medications, and so then we figure out a way for both things to happen. But I think that more often than not, people are not taking their medications because of the expense, and so I'd really like to see something happening. And so this week there have been congressional hearings going on, interviewing a lot of the CEOs of drug companies and talking about their profits, talking about the CEO and other high-ranking individuals in those companies and their particular bonuses that they're getting because they meet certain profit margins and those types of things. And I think that if some of that money were able to be either returned to the people that are buying those drugs, or just decreasing the price of the drug altogether, we might have people being treated, more effectively for their actual disease states. And so I'm a little bit more cognizant of, like, how much does something cost, and making sure that people are getting treated, because I think what's going to end up happening ultimately is if the patient isn't treated appropriately, they're going to end up having to potentially draw on government resources, Medicare, Medicaid, something like that, in order to get some really big complication taken care of. And so the government is still looking at, having to help pay for that. And so is there some way that we can avoid that from happening?
Yeah, I think that's very important, more of like preventative care and making sure patients, because you're right. We even see it in our education of how do you separate the two? How do you deal with someone who can't, you're right, it's either groceries or their medications, and how to help them with that. So I think that is a very, very important part of the pharmacy profession as we go forward. So the next steps, how do you think being in academia and being at your practice site has kind of influenced the way you see pharmacy or even how you practice it?
I would say I really enjoy what I'm doing now, and I think partly because I feel like I am able to practice at the top of my license and what I can do as a pharmacist versus, my former life I've done a lot of different types of pharmacy. I've worked long-term care, I've worked retail, I've worked hospital, and I wouldn't tell you that any of those were bad. I love pharmacy in general, so I liked all of them, and my experience with all of them, of course, made me who I am now. So I can't discount any of that. But I would say that, I see a lot of my colleagues, a lot of my friends, some of my family, both my husband and my sister are pharmacists. And I kind of see the way that community pharmacy is kind of going right now with, the pharmacy benefit managers being able to take back money and take money away from the pharmacies, even when maybe it's, they say, well, you don't have this documented, or you don't have this, or you've done this incorrectly. And each different pharmacy benefit manager, different insurance company has their own rule as to what's correct and what's not correct and that kind of thing. And so I just see a lot of changes kind of coming, and it's pharmacy has changed so much, and I am excited about the changes that are even more of them that are coming along. But I think that for sure we need to be watching how we're running community pharmacies, and that the community pharmacist isn't any different from your hospital pharmacist versus your clinic pharmacist, that we all really need to be working together rather than being siloed in our own separate entities. And so how, as a profession, how do we make sure that is happening? So how do we build those bridges between and kind of connect all of the dots so that we're all on the same page?
Yeah. Thank you so much. Do you have any final comments or?
I just hope that anyone who's watching this sees the enthusiasm and the passion that I have for pharmacy, but also that it inspires you to continue your journey in pharmacy, and really go out there and make a difference, because our profession is really young in the grand scheme of things. Although you could date it way back to like the 1600s and different things that are going on then, but I think that it's really important that we get out there and that we showcase what we can do and use our voices to be recognized for what we can do.
Well, thank you so much for joining us and letting me kind of pick your brain. So I hope you have a great rest of your day.
Okay. Thanks, Tessa.
Thanks. Perfect.
Okay.
You did great. Killed the game.